Hello friends, this is the fourth part of the medicine plus pathology question in the series of Rajasthan Medical Officer PYQ questions. So let's start with the first question today. First question for today is popcorn calcification is characteristically seen in. So we know that the popcorn calcification is a feature of pulmonary hematoma. So answer will be option number C, pulmonary hematoma. So what is hematoma? Hematoma is the presence of abnormal tissue at normal place. So this is hematoma. So answer will be pulmonary hematoma. CD4 is not important for which of the following? So options are cytotoxicity. This is true. Memory B cells. This is again true. Opsonization. Yes, it is one of the important function of CD4. Immunoglobulin production. So immunoglobulin production is mainly done by plasma cells and B cells, or the B lymphocyte. So answer here will be option number D, that immunoglobulin production is not directly related to the CD4. Next question is, a 40-year-old male has undergone splenectomy 20 years ago. Now peripheral blood smear examination would show the presence of. So first option is Dolia bodies. This is not true. Hypersegmented neutrophils. Hypersegmented neutrophils is seen in the deficiency of vitamin B12, leading to the megaloblastic anemia. Spherocytes is seen in the hereditary spherocytosis, not in this. And Hovell Jolly bodies. So this is true that after splenectomy, the peripheral blood smear will show for Hovell Jolly bodies. So answer here will be option number D, Hovell Jolly bodies. Which of the following metabolic abnormality is seen in the multiple myeloma? So if we talk about the multiple myeloma, then we know that in multiple myeloma there is increase in the calcium. So hypercalcemia will be there. So answer will be option number C, hypercalcemia. If we have to talk about the other feature of the multiple myeloma, then it is slim crab, in which C is for the calcium increase, R is for the renal insufficiency, A for anemia, B for bone disease. Now, in slim, S is for 60% of the plasmocytes, light chain, and M for MRI, one or more focal lesion present. So, this is Crab slim, which are the features of the multiple myeloma, and answer here will be hypercalcemia, that increased calcium will be there. Next question is feature of essential hypertension. So concentric hypertrophy of left ventricle, this is true. Increased size of heart muscles, yes, this can be true but not always seen. And myohypertrophy, yes, of course this can also be seen, but not always. And myohyperplasia is not seen. So overall, whenever there is a pressure, when pressure is increased on the walls of the heart, there will be increase in the muscle of the heart also, hypertrophy will be there. But the main feature of the essential hypertension is concentric hypertrophy of the left ventricle, because there is sometimes a decrease in the pressure, then again increase in the pressure, which lead to the concentric hypertrophy of the left ventricle. So best answer here will be concentric hypertrophy of left ventricle. Option number B and C can also be correct, but best answer is concentric hypertrophy. Next question is all are non-proliferative glomerulonephritis except. So they are asking about the proliferative one. So membranous glomerulonephritis is a non-proliferative. Mesengiocapillary glomerulonephritis is a proliferative type. So it cannot be the answer. It means it is non it is a proliferative one, and diabetes glomerulosclerosis is non-proliferative, and amyloidosis is nowhere related to it. So answer here will be mesengioglomerulonephritis, which is a proliferative one. Mesengioglomerulonephritis, which is the proliferative one. False about alcohol in disinfection is ethanol is used. This is true. Isopropyl alcohol is used. This is also true. Has sporicidal activity? No. Has bactericidal activity? This is true. So the alcohol do not have the sporicidal activity. So option number C is false. Next question is bile salts are derived from. First option is bile salts. Sorry, the question is bile acids are derived from. First option is bile salts. This is not true. From bile pigments, again this is not true. Option C is bile salts and bile pigment, no. And fourth one is cholesterol. So this is true. We know that the bile acids are formed from the cholesterol in the liver. So cholesterol in liver is changed into bile acids. And then after that, these bile acids are changed into the bile salts. So they will form the bile salts. And what are bile pigments? So bilirubin, biliverdin, these are the bile pigments. So answer here will be option number D, cholesterol. That cholesterol change into the bile acids in liver. So next question is the chemotactic factor is. So if we talk about these factors, then two important things are there. One is chemotactic factor and one is opsonization factor. So for chemotaxis, most important factor is C5A, and similarly C3A and C4A. But if we talk about opsonization, then most important factor is C3B. Then after that C5B. So now they are asking about the chemotactic factor. So C2A is not a chemotactic factor. C3B is a opsonization factor. C4A is a chemotactic factor, but C5A among them is the best one. So chemotactic factor is C5A, option number D. So this is most important in chemotaxis factor, and C3B. C3B is most important in opsonization factor. So next question is feature of milk alkali syndrome. So what is milk alkali syndrome? Milk alkali syndrome occur due to the more ingestion of the alkalis or the calcium antacids like this. So due to increase consumption of calcium and antacids. And the feature which is seen in the milk alkali syndrome is hypocalcemia. Second is alkalosis. Third is renal failure. And fourth one is bicarbonate retention. Sorry, hypercalcemia is there because it occurs due to the increased consumption of calcium. So hypercalcemia. Now if we talk about the option, then first option is hypercalcemia. This is true. Hypervolemia, no, due to the increased consumption of the these calcium and the antacids. Hypovolemia like condition will be there. Hyperparathyroidism, this is also false because calcium is increased, so parathyroid hormone will decrease. And diarrhea, no. So answer here will be option number A, hypercalcemia. Another feature we have also seen that alkalosis, renal failure, and bicarbonate retention will be there. Next question is ventilator induced injuries occur due to all except. So subtracheal stenosis, yes, this can occur due to ventilator. Barotrauma can be there. And atelectasis, no, atelectasis is generally the collapsing of the lung which occur due to the insufficient air supply, or if there is any injury to the chest wall which will lead to the atelectasis. Atelectrauma, yes, this is true. So air related trauma can be there, but uh, due to the excessive air, atelectasis cannot be there. So answer will be option number C, atelectasis, which is the collapse of the lung which occur due to mainly either the inappropriate supply of the air, or it may be due to the increase in the increase in the pressure on the lungs due to any trauma on the chest wall. So option number C will be the correct answer. So next question is criteria of febrile neutropenia is. So if we have to talk about the criteria of febrile neutropenia, then two criteria are there. One is one reading should be greater than 38.5 degree, and one or three reading greater than 38 degree in 24 hours. So first option is axillary temperature greater than 39 degree Celsius. So it is not a criteria. One oral temperature greater than 38.5. This is true. So this is correct. A sustained oral temperature of greater than 38 for more than 1 hour. No, it should be for at least 24 hours. Both axillary temperature and a sustained oral temperature greater than, so this is also false. So here best answer will be one oral temperature greater than 38.5 degree centigrade. True about atrial premature beats. So abnormal with associated with abnormal p wave, this is true. All p waves are normal in morphology, no. All p waves are not normal. There can be different morphology of all p waves. Each p wave is followed by s complex, so this is also not always correct. And so sawtooth pattern in lead 2, this is also not correct. It is seen in the atrial flutter. So here answer will be associated with abnormal p wave, which is a general option. So answer will be option number A. Next question is in comparison to obstructive lung disease, restrictive lung disease of the pulmonary function test show decrease of. So if we talk about the OLD and RLD, in OLD increase in the total lung capacity is there, increase in residual volume is there, decrease in FEV1, decrease in FVC, and decrease in FEV1 upon FVC ratio. So this is seen in the obstructive lung disease. In restrictive lung disease, decrease in total lung capacity is there, decreased residual volume, normal or increase in FEV1, or increase or normal FVC, and similar thing with the FEV1 upon FVC ratio. So it is either normal or increase. So now if we see they are asking about that restrictive lung disease will show decrease of what thing. So there are two things which will decrease in RLD, which is total lung capacity and the uh, residual volume. So if we talk about the option then FEV1, so it is not decrease, it is either normal or it is increase. Forced residual capacity. So we know that the residual volume decrease, so forced residual capacity will also decrease. So this is true. FeV1 upon FVC, so it is either normal or increase, and none of the above. This is also not true. So answer here will be option number B, forced residual capacity, which is decrease in the restrictive lung disease. Now, next question is which of the following is or are not true about Kaposi sarcoma? So, African form mainly occur in older men. This is not true. It is there is no such epidemiological finding that it is more common in men. It is both. It is equal in both male and female. So, it is same in both male and female. Then interferon alpha is used in the treatment. This is true. HIV-associated Kaposi sarcoma regress with the antiretroviral therapy because it is associated with HIV. So if we treat the HIV or if we give any retroviral therapy, then Kaposi sarcoma will also get decreased. Caused by HHV8. So we know that Kaposi sarcoma is associated with HHV8, which is a virus. So antiretroviral therapy also act here, and it is caused by HHV8. This is true. So answer will be option number A, that African form mainly occur in older men. This is not true. It is same for both male and female. Now next question is diagnostic criteria for severe aplastic anemia includes all except. So if we talk about the criteria, then absolute neutrophil count is less than 500 per microliter. This is true. Platelet count less than 20,000 per microliter. This is also true. Hemoglobin less than 8 gram per dl. This can be true, but it is not present in the diagnostic criteria. Um, and bone marrow cellularity is less than 25%. So this is also true. Though in the new criteria, bone marrow cellularity is also not given, but in the older criteria it is there. And one other criteria is reticulocyte count less than 60,000 per microliter. So ABC, which is absolute reticulocyte count should be less than 60,000 per microliter. So answer will be option number C, that hemoglobin less than 8 gram per dl is not a diagnostic criteria for severe aplastic anemia. So a cancer patient who is ambulatory and about more than 50% is in waking hours. So it is important thing that more than 50% in waking hours. Now he is not able to perform work activities but able to perform his daily activity. So daily he is performing daily activity for self care without assistance. So this is also important that he do not need any assistance for his daily activities, and he is more than 50% in waking hours. So now which of the following is the performance scale or the index he belongs to? So for more than 50% is waking hours, ECOG grade 2 is there. So option number B will be the correct answer. ECOG grade 2. Answer will be option number B. So there are four grades, grade 0 and 1, 2, 3. So you have to read all of them from the notes. All are true statement regarding metaplasia except metaplasia is irreversible change in which one differentiated cell type is replaced by another cell type. So this is incorrect because irreversible change is given, but we know that metaplasia is the reversible change. So this is false. Now, the most common epithelial metaplasia is columnar to squamous as occurs in the respiratory tract in response to the chronic irritation. This is true. A deficiency of vitamin A, which is retinoic acid, induces squamous metaplasia in the respiratory epithelium. This is also true. And the influences that predisposes to metaplasia, if persist, can initiate malignant transformation in the metaplastic epithelium. This is also true. Um, we see in the Barrett's esophagus that firstly metaplasia is there. After that, dysplasia will occur. After that, malignant change occurs. So this is also true. So option number A is incorrect because it is not a irreversible change. Metaplasia is the reversible change. Next question is chronic inflammation is characterized by all of them except. So first option is infiltration of mononuclear cells which include macrophage, lymphocyte and plasma cell. This is true. Macrophage, lymphocyte and plasma cells are present. Tissue destruction induced by the persistent offending agent or by the inflammatory cell. This is also true because they are asking about the chronic inflammation. Attempts at healing by connective tissue replacement of damaged tissue accomplished by angiogenesis and in particular fibrosis. This is also true that for the healing angiogenesis will be there or the fibrosis can also occur. Blood leukocytes, principally neutrophils, accumulate along the vascular epithelium, endothelium. So this is false because neutrophil is seen in the acute inflammation, not the chronic inflammation. But they are asking about the chronic inflammation. So this is a false statement. So answer will be option number D. Um, that blood leukocyte, principally neutrophils, which accumulate along the vascular endothelium, it is not seen in the chronic inflammation. Next question is all are true about inflammatory bowel disease except. So ulcerative colitis is limited to the colon and rectum and extend only into the mucosa and submucosa. This is true. Crohn's disease may involve any area of the GI tract and is typically transmural. This is also true. But the most common site is terminal ileum. Most investigators believe that IBD results from the combined effect of alteration in the host interaction with the intestinal microbiota, intestinal epithelium dysfunction, aberrant mucosal immune response, and altered composition of the gut microbiome. This is true that multiple factors are responsible. There is no single factors. The presence of multiple separate, sharply delineated areas of disease resulting in skip lesions is characteristic of ulcerative colitis. So this is a false statement because we know that these skip lesions are the feature of Crohn's disease. So this is false statement. Answer will be option number D. It is a false statement. Next question is pathologic response to glomerulus to injury. Include all of them except. So hypercellularity, this is true. Basement membrane thickening, of course, this is true. And hypocellularity, no. Hypercellularity will be seen in response to the injury. And hyalinosis and sclerosis can occur. This is also true. So answer here will be option number C. That hypocellularity is not seen. Pathologic response. So we have already done this question. Characteristic histological finding of asthma, collectively called as air remodeling, are all of them except. So thickening of airway wall, this is true. It is seen in remodeling. Subbasement membrane fibrosis due to deposition of the type 1 and type 3 collagen. This is also true. Decrease in the size of submucosal gland and the number of airways goblet cell. This is false because increase in submucosal gland is there and also goblet cells is also increased. So this is not true. Hypertrophy and the hyperplasia of the bronchial wall muscle. This is also true. So here wrong option is option number C. The decrease in size of submucosal gland is there, but we know that in reality there is an increase in the size of submucosal gland and also increase in number of the goblet cell is there. Next question is all are true. All statements are true except. So first is cortex is the outer region located just under the kidney capsule. This is true. We know that if we make kidney, then this outer part is cortex and inner part is medulla and this outer thing is kidney capsule. So according to first question, the Cortex is located under the kidney capsule. This is true. Medulla is central region divided into outer medulla, inner medulla. This is also true. The papilla is the innermost tip of the inner medulla and empties into the pouches called minor and major calyx. So calyx are present mainly in the inner part of the medulla. So this option is also correct. The glomeruli of the juxtamedullary nephrons are smaller than those with the superficial cortical nephrons. Accordingly, have the low GFR. So this is a false statement because we know that the juxtaglomerular nephrons are are more longer one, and they have the glomeruli is not smaller, it is bigger than the superficial cortical nephrons. So this is not true. So answer here will be option number D. The glomeruli of the juxtamedullary nephron should be larger. Hormones secreted by the anterior pituitary are all except. So first is growth hormone, this is true. Prolactin, this is also true. Vasopressin or the antidiuretic hormone. So this is not true. It is formed in the hypothalamus and secreted by the posterior pituitary. Luteinizing hormone, this is also true. So answer will be option number C. Next question is, which is not true about the enteric fever? So following ingestion of the contaminated food and water, the organism colonizes the Peyer's patches in the terminal ileum, causing hyperplasia of the lymphoid follicles followed by the necrosis and ulceration. So this is true. Microscopic pictures show erythrophagocytosis with histiocytic proliferation. So this is also true. It is a pathology. It is a part of the pathology of the enteric fever. And commonest site of the perforation is the terminal ileum, terminal jejunum. This is not true. It should be terminal ileum. When a typhoid proliferation occurs within the first, when a typhoid perforation occurs within the first week of the illness, so the prognosis is better than if it occurs in the second or the third week. So this is also true. Whenever there is perforation in the first week, then it have a better prognosis. So answer here will be option number C, that the common site of perforation is not the terminal jejunum, it should be terminal ileum. Kartnagar syndrome is characterized by each of the following except. So for the Kartnagar syndrome, there is a trick which is SBI, which is site sinusitis, bronchiectasis, and inverters or the situs inverters. So mental retardation is not there. Dextrocardia, which is a inverter, situs inverters is there, bronchiectasis is there, and sinusitis is also there. So answer will be option number A. Mental retardation is not a feature of the Kartnagar syndrome. All are the chest X-ray finding of pulmonary embolism except. So Westermarck sign, this is true. Hampton's hump, this is also true. McConnell signs. McConnell signs is also seen in the pulmonary embolism, but not on the chest X-ray. It is seen on the echocardiography. So it is a ecological finding. Echo finding. And Pallas sign. So this is also true. It is seen in the X-ray. So answer will be McConnell sign, which is a echo finding. All are true about ultrasonic imaging except. So they are asking about USG. It uses ionizing radiation. So this is false. It uses ultrasonic waves. Uses high frequency sound waves to make images. This is true. An image is made by sending high frequency sound into the patient and assessing the magnitude and the time of returning echoes. This is also true. And ultrasound images can be quite dependent on the operator set parameters and the field of view within the patient. This is also true. So here the wrong option is it uses ionizing radiation. This is false. Next question is, all of them are associated with massive splenomegaly except. First option is Gaucher's disease. This is true. Chronic myeloid leukemia. This is also true. Massive splenomegaly. Polycythemia vera. This is also true. Tuberculosis. No. It is an infective condition and it is not present with the massive splenomegaly. If we talk about some infective condition, then Kala Azar, malaria will lead to the splenomegaly, but not the tuberculosis. So this is a wrong option. It do not present with the massive splenomegaly. Next question is feature common to most patients with hemolytic disorders except. So reticulocyte usually decrease. This is not true. We know that in hemolytic disorders, reticulocyte count increases. Bilirubin almost always increase and mostly unconjugated. This is true. Heptoglobin reduced to absent if hemolysis is at least in part intravascular. This is also true. Heptoglobin is decreased. LDH increase with intravascular hemolysis. This is also true. So here option number A, which is reticulocyte usually decrease, is the wrong option because we know that in hemolytic disease, reticulocyte count increases. Next question is according to revision of the Jones criteria for the diagnosis of acute rheumatic fever in the era of the Doppler echocardiography, all are minor criteria in the moderate and high risk population except. So they are mainly asking about the moderate and high risk population and the minor criteria. So monoarthralgia, this is true because monoarthralgia in even monoarthralgia, which means that there is a pain in single joint, is a minor criteria in the high risk population. Fever greater than 38 degree, this is also true. Polyarthralgia, polyarthralgia is minor Jones criteria in the low risk population. In high risk, monoarthralgia is considered as a criteria, so this is not true. And ESR greater than 30 mm per hour or the CRP greater than 3.0 milligram per deciliter. This is also true. So here answer will be option number C, polyarthralgia, which is not a minor criteria in the case of the moderate or the high risk population. Next question is all are criteria for diagnosis of diabetes mellitus except symptoms of diabetes plus random blood glucose level greater than 11.1 millimoles, which is equals to 200 milligram per deciliter. This is true. Hem, uh, Hemoglobin A1C, HbA1c greater than 7.5. So 7.5 means the diabetes is there, but it is not a criteria for the diagnosis. The criteria for diagnosis is greater than 6.5. So this is wrong. It should be 6.5. Fasting plasma glucose greater than 7 millimoles per liter, which is equals to 126 milligram per deciliter. This is true. And 2 are plasma glucose greater than 11.1 millimoles or the 200 milligram per deciliter during an oral glucose tolerance test. This is true. So here wrong option is option number B, that HbA1c should be greater than 6.5 for the diagnosis of diabetes mellitus. Next question is all are absolute contraindication to the use of fibrinolytic agents except. So history of cerebrovascular hemorrhage at any time. This is true. Non-hemorrhagic stroke or other cerebrovascular event within the past year. This is also true. Suspicion of aortic dissection. This is also true. Pregnancy. No, pregnancy is not absolute contraindication for the use of fibrinolytic agents. If required, then we can use fibrinolytic agents in pregnancy. So this is true. This is a false statement that pregnancy is not a contraindication. All are true for crackles and bronchi except. So crackles are sign of alveolar disease. This is true. Process that fill the alveoli with fluid may result in the crackles. This is also true. Crackles in pulmonary edema are generally more prominent in the lung effects. This is false because they are more common in the base. And bronchi are manifestation of the obstruction of the medium-sized airway. This is true. So here answer will be option number C, that crackles in pulmonary edema are generally more prominent on lung apex, which is a false statement. Next question is, all are true about Gilbert syndrome except this syndrome is characterized by unconjugated hyperbilirubinemia. This is true. Liver enzymes AST or ALT are usually elevated. No, this is not true. Gilbert is generally present in the adult and liver enzymes are generally normal. Serum bilirubin concentration are often less than 3 milligram per deciliter. This is true. And more elevated values are associated with stress, fatigue, alcohol, reduced calorie intake, and in intercurrent illness. So this is also true. So here option number B is incorrect. Next question is, all are electrocardiogram manifestation of hyperkalemia except so tall P wave. This is false. Either there is a decrease in the P wave or absent P wave is there in the hyperkalemia. Tall peaked T waves. This is true. Sine wave pattern. This is also true. And QRS widening. This is also seen. So here tall peaked P waves will not be there. Answer will be option number A. So next question is, the appearance of sleep spindle and K complex in EEG is correlated with dash part of sleep. So if we talk about NREM1, then theta waves are present. For REM, beta waves present. For NREM, it is sleep spindle. NREM2, it is sleep spindle and K complex. So answer here is option number 4, NREM2. All are true about acute rheumatic fever except develops after streptococcal pharyngitis. This is true. Common in poor socio-economic group. This is not true. This is also true, of course. Communicable disease. No, this is not true because we know that streptococcal pharyngitis is a communicable condition, but the acute rheumatic fever is not a communicable disease. So it is not a communicable. Seen in the children 5 to 15 years of age. This is also true. So answer will be option number C. Which of the following is the cause of euvolemic hyponatremia? So first is nephrotic syndrome. No. In nephrotic syndrome, uh, hypervolemic hyponatremia will be there. Hypovolemic hyponatremia will be there. Mm. In SIADH, euvolemic hyponatremia is present. This is true. And cerebral salt wasting and diuretic use. In these both two conditions also, hypovolemic hyponatremia will be there. So here answer will be syndrome of inappropriate ADH secretion, SIADH. Normal anion gap metabolic acidosis is seen in all the following except. So renal tubular acidosis type 2. In all type of renal tubular acidosis, we know that NAGMA is present, which is normal anion gap metabolic acidosis. So in all types, NAGMA is present, but not in the uremia of renal failure. In uremia of renal failure, generally high anion gap metabolic acidosis is present. Next question is, bilirubin in urine will be found in following condition. So we should know that bilirubin in urine is generally present when conjugated bilirubin is present. So conjugated bilirubin will go into the urine, and conjugated bilirubin increase in the condition wherever there is a obstructive jaundice. So if we talk about the option, then Dubin-Johnson syndrome, yes, it is a type of obstructive jaundice. This is true. Crigler-Najjar syndrome, Gilbert syndrome. These both will lead to the increase in the unconjugated bilirubin. So this is not true. And sickle cell disease will also lead to the hemolysis, which will lead to the unconjugated increase in the bilirubin. So this is also not true. So here answer will be Dubin-Johnson syndrome, and another condition can be Rotor syndrome, in which obstructive jaundice is there and conjugated bilirubin increase, which will lead to increase in the bilirubin, increase in the urine. So here answer is Dubin-Johnson syndrome. Next question is clot retraction process at the end of clot formation is done by. So we know that this clot retraction process is done by factor number 13, which is a fibrin stabilizing factor. So answer is option number 3. Buerger's disease is characterized by. So Buerger's disease is occlusive disease of large size arteries. This is false. For large size arteries, mainly we know that Takayasu arthritis is there, giant cell arthritis is there, but not the Buerger's disease. Occlusive disease of small and the medium size vessel. This is true. Occlusive disease of the large size vessels. No, this is not true. Occlusive diseases small and the medium sized arteries. So they in the fourth option they have mentioned only arteries, so this is also not true. So Buerger disease is mainly the occlusive disease of small and medium sized vessels, in which arteries, veins both are there. Salt and pepper erosion of skull is typically seen in. So this is a direct question. We know that salt and pepper erosion of skull is seen in primary hyperparathyroidism. Option number 4. Earliest sign of diabetic neuropathy is gastroparesis. No. Erectile dysfunction. It occurs, but occurs in the later stages. So this is not true. Distal sensory loss. This is true. That firstly a sensory loss will be there. Then after that any other finding will be there. And hydrosis of the lower extremities. This is also seen, but in the later stage. So this is also not true. So answer will be option number C. Distal sensory loss is the earliest sign of the diabetic neuropathy. Next question is characteristic symptoms of asthma is. So they are asking about the asthma. Characteristic symptoms are wheeze, dyspnea, and coughing. So option number 2 is the correct answer. So I have taken these questions from the paper itself. So the answers are marked already. Oxygenation of hemoglobin lowers its affinity for carbon dioxide is called as. First option is Bohr's effect. No. Bainbridge is totally a different thing. Haldane effect. This is true. And Herring-Brewer reflex is again a different thing. So answer here will be oxygenation of the hemoglobin lowers its affinity for carbon dioxide is called as the Haldane effect. Which of the following is investigation? Which of the following investigation is recommended for the diagnosis of enteric fever at the fourth day of the onset of fever? So they are asking about the fourth day, which means they are asking about the first week. So first, second, third, fourth week, we have a trick which is Basu. So in first week we have to do blood culture. In second week for the antibody detection, which is a Vidal test. Then Vidal test. In the third week stool culture, and the fourth week urine culture. So here answer will be blood culture, because they are asking about the fourth day, which is the first week. Next question is, which type of thyroid carcinoma is associated with RET mutation? So options are follicular carcinoma. No. Papillary carcinoma. Yes, this can be true. Uh, but it is mainly associated with BRAF and it can also associate with red. Thyroid lymphoma, no. And medullary carcinoma, so this is also true. It is also related to red. So according to me, the answer should be option number 4, not 2, because um, papillary carcinoma is associated with also other mutations also, but medullary carcinoma is mainly associated with the red mutation. So option number 4 should be the correct answer. Next option is next question is SA node generates the impulse at the highest rate as compared to the other autorhythmic tissue because its RMP is close to the threshold. This is correct. It is of larger diameter due to the larger diameter of its fiber. No, due to better autonomic neural control. This can be true, but it is same for all the tissue of the all the nodes of the heart. So this is not true. Activation of the fast voltage gated sodium channels. So this is also not true. So here answer will be its RMP is close to the threshold. So it is better option among the all. The diuretic of choice for rapid relief of congestive symptoms in the patient of congestive heart failure is so metazolone, no. Furosemide, this is true. It is a diuretic of choice in the congestive heart failure patient. Hydrochlorothiazide can be used, but furosemide is better. Amiloride, no. So here, best answer is furosemide, but if not available, then hydrochlorothiazide can also be used. Which nerve carries sensation of pain due to pericarditis? So, first option is vagus nerve, no. Superficial cardiac plexus, no. Deep cardiac plexus, no. Phrenic nerve, this is true, that phrenic nerve mostly carries the sensation of pain due to pericarditis. Clavulanic acid is combined with amoxicillin because so it inhibits the beta lactamase because it is a beta lactamase inhibitor, and so it inhibits the beta lactamase that destroys the amoxicillin. So it in turn will prevent the amoxicillin from getting destroyed so that amoxicillin can work. So here option number 1 is the correct option, that it inhibits beta lactamase that destroys the amoxicillin. All are cardinal signs of inflammation except. So first is cyanosis, no. Pain, this is true. Redness is there and swelling is there. So cyanosis is not a cardinal sign of inflammation. Following is not a diagnostic criteria of Behçet disease. Granulomatous anterior uveitis. So this is false. In Behçet disease, of course, the ophthalmological findings are there, but granulomatous anterior uveitis is not there. Positive pathology test, this is true. Retinal vasculitis is also there. Recurrent oral ulceration is a specific finding. So granulomatous anterior uveitis is not there. Instead, chorioretinitis can be there. Next question is treatment of tension pneumothorax is pleural tapping in second intercostal space. No. Immediate decompression by the rapid insertion of the large bore cannula needle into the second intercostal space followed by the ICD insertion. So this is true. Video assisted thoracoscopy and draining. This can be done but not in the tension pneumothorax. It can be used in the spontaneous pneumothorax. Immediate intercostal draining tube insertion. So ICD insertion is done, but firstly decompression is done with the large bore needle. So this is also false. So here option number 2 is the correct answer. A 35-year-old male develops atrial fibrillation. His pulse likely to be so in atrial fibrillation we know that irregular pulses are there. So first option, irregular in rate as well as irregular in volume. This is true. Collapsing, this is false. Regularly irregular, this is not true because we know that it is irregularly irregular. And irregularly in rate but regular in volume, this is again false. So here our answer will be option number 1, that it is irregular in rate as well as irregular in volume. Next question is, early aggressive immunosuppressive therapy is indicated in SLE patient with first option is Apla syndrome, no. Pleuritis, no. For the shrinking lung syndrome, yes. For the shrinking lung syndrome, it is a fatal condition. So in this condition, early aggressive immunosuppressive therapy should be indicated. Thrombocytopenia, no. So option number C will be the correct answer because it is a fatal condition and can lead to the death of the patient. In hypothermia, cause of death is pulmonary embolism. This is not true. Stroke, no. Cardiac arrest, this is also false. Anoxia, this is true. Anoxia generally lead to the death in the hypothermic patient. Failure of mineralization of bone and excess of osteoid formation in 25-year-old male is known as. So failure of mineralization in adults is known as osteomalacia. So answer will be option number 3. Rickets is seen in the children's and osteoporosis is generally seen in the um, females after the menopause, and it is due to the demineralization of the bone leading to the pores in the bone, which will make the bone brittle and easy to get fractured. Next question is, a fasting blood sample would be required in the estimation of the following except first is thyroxine. So in thyroxine, fasting blood sample is not required. Glucose, yes. In iron also, and triglyceride also for the lipid profile. So for thyroxine, fasting blood sample is not required. In adults, extravascular fluids differs from intravascular fluid in that anions are mainly inorganic. This is true. pH is lower. No, this is not true. pH is higher, more alkaline it is, and volume is greater. Um, this is not true. Volume is more in the intracellular fluid, and tonicity is lower. No, this is also false. So here answer will be anions are mainly inorganic. This is true. Next question is paralysis of third, fourth, and sixth nerve with involvement of ophthalmic division of the trigeminal nerve is seen in the lesion of which of the following? So they are asking about all the three nerve 3, 4, 5, 3, 4, 6, and the division ophthalmic division of cranial nerve 5. So we know that these all passes from the cavernous sinus, or they are related anywhere from the cavernous sinus. So any injury or the lesion to the cavernous sinus will lead to the paralysis of these nerves. So answer will be option number C, cavernous sinus. Next question is, Kirschmann spirals are seen in. So first is pneumonia, no. Emphysema, no. Subacute bacterial endocarditis, no. In this vegetations are present. Bronchial asthma, this is true. So if we talk about the bronchial asthma, then Crayola bodies are also there. And Charcot Leyden crystals. And of course the Kirschmann spirals. So 3C findings are there. Next question is, translocation seen in CML is. So this is a direct question. Translocation 922 is seen in the CML, which will lead to the increase in the tyrosine kinase activity, for which the treatment is imatinib, which are tyrosine kinase inhibitor. So answer will be option number B. So these are all questions which are related to medicine plus pathology. There are total, I have made the videos and there are lots of questions. So I made the videos in 4 to 5 parts, and now all the questions are covered. You can watch those videos also which I have already covered of different subjects. And if you want any other topics or any other questions, then you can comment below. I will upload those videos also. So thank you so much.